Fantastic. Hello, everyone. Welcome to Need for Seed HealthTech Edition. My name is Margaret Ann, and I'm here alongside Purdy and Anthony, who is the founder of Seed Legals. So what is going on today? We have 6 fantastic startups, HealthTech startups, who are going to be pitching a panel of sector-specific superstar angel investors and VCs who all have really vast experience in the health tech space. So each founder is going to have 10 minutes to present. The first 3 minutes will be for the pitch, followed by 7 minutes for the Q&A. At the end of the Q&A, each investor will have to say a thumbs up or a thumbs down for a follow-up meeting. So during the Q&A portion, feel free to drop in any questions that you might have for the founder in the chat section of the YouTube page. If we don't have time to pull in audience Q&As, if the investors have so many questions and it takes up the full 7 minutes, all of the founders will be available in the question portion after their pitch, so you'll be able to get your questions answered. So for the format, after I'll pass it over to Purdy and Anthony, and then we're going to hear a quick little introduction from each investor. Then we'll get straight into things. Also, feel free to join us on Twitter. We're going to be live tweeting the event, and we'd love to hear all of your feedback as well. So Purdy, take it away.
Hi, I'm just going to talk to you a bit more about Spice Startups and what we do. So myself and Margaret Ann started Spice about 7 months ago, and we work with startups, scale-ups, and the investors who fund them. So you'll often find us putting on events such as this and trying to connect the startup ecosystem with the investment ecosystem and making sure startups get as many opportunities as they can to get in front of investors, raise money, and be able to scale their company. We do this by partnering with different organizations such as Seed Legals. And this is our 3rd or 4th event with Seed Legals now, which is all aimed at fundraising. So if you want to find out more or you want to speak at one of our future events, you can follow us at Spice Startups on social media, log onto our website, spicestartups.com, subscribe to our mailing list, and you can get all the information there. I will pass over to Anthony, and then we will get our investors on screen.
Hello, everyone, and welcome to Need for Seed HealthTech Edition. So hi, I'm Anthony Rose. I'm founder and CEO at Seed Legals. Seed Legals, as I hope we all know, is the fastest way to close your next investment or funding round. Now, of course, over a year ago and before that, we all hung out at pitch events at WeWork and elsewhere. There was nothing like a warm beer, someone on stage trying to understand, listen what they're saying, bad pitches. So our mission has been to create that atmosphere again. Bring your own warm beer, but no, jokes aside, our goal at Seed Legals is to help you close your funding round. More than 1 in 6 of all early stage investments in the UK is now done on Seed Legals. We've seen a boom in funding rounds over the last year. There are more than 50 rounds a week open now on Seed Legals. We're about 70 people and growing. So the first takeaway point for me is that when things happen, Brexit, COVID, do not procrastinate. Keep going. The best founders have the best ideas and are still out there raising investment. And the best investors want to be part of the best deals and are still investing. So what you want to do is you want to hone your online pitch skills, the art of the Zoom pitch. And in our small way, can we not just help with the funding round deal docs, but also help connect people with investors and help develop the art of the pitch so that everyone understands. So with that, that's probably enough for me. Everyone, please meet today's dragons. If you would like to, of course, invest or contact any of the people who are pitching, please do so. If you'd like to be part of the next Need for Seed, I've no idea what it will be, but just like Die Hard, there'll be another one. And drop me an email and we'll put you forward for that. So team, over to you. Thank you very much.
We'll also be sharing a special Seed Legals discount code for everyone who's registered on Eventbrite. So if you're just joining us from YouTube, make sure you head over to Eventbrite, fill out a form, and we'll send you a discount code. Great.
Welcome to our investors. We're going to take ourselves off the screen, but just please do a round robin and introduce yourselves. If you're working for a fund, what fund you're working for, what your background is, why you're interested in health, and for our angels, your background and experience as well. Starting with George, and then you can just go around.
Hello, everyone. Hey, thanks so much for organizing. And we're looking forward to today's pitches. My name is Georg. I'm principal of IQ Capital. We are a seed and Series A fund investing in outstanding founders with great products. Also in the health tech space, where we had great successes and we have great interest in there. My background is computer science. I worked as a health tech consultant before in a big enterprise, where I had the first-hand experience that startups are really the solution of the future for health tech, and look forward to meeting a lot of them today.
Shall I jump in? I'm Namrata. I'm one of the angels today. Delighted to be here and excited to see all the startups. My background is as a primary care doctor. I work as a GP partner in a practice in Surrey. I also have a former NHS commissioning role on the Surrey Heath CCG, and I work as an angel investor and advisor for startups, mainly in the digital health and SaaS space. So excited to see the startups today. Welcome.
I can go next. Hi, everyone. Thanks a lot for having me. So I'm part of the Octopus Ventures health investment team. So we're a London and New York-based VC investing in seed to Series B pioneering startups. So, I mean, it could be from consumer health all the way through biotech and everything in between, so pretty wide remit. My background is I'm originally a civil engineer, although I didn't do that much of that activity, but then mixed in entrepreneurship and then working in startup partnerships and acquisitions for big tech and big pharma.
Hi, everyone. It's Philip here. I'm one of the angels. My background is in applied sciences and specifically clinical nutrition. And I invest in early seed startups. My key interests are in the ecosystem of supporting a client success journey, whether that's anything from DigiHealth apps, wearables, hospitality settings, etc., etc. I'm really excited to be here today, and I look forward to hearing from our startups today. Thank you.
So, hi everyone. My name's Ahmad Chugtai. I run a business which is one of the leading suppliers of digital solutions to the NHS, and it's actually interesting that the name of Surrey Heath CCG was mentioned because they actually happen to be one of our customers as well. But prior to that, I had an extensive corporate career working for large organizations, primarily within the life sciences and healthcare industries, all within the tech space, both from a commercial manufacturing as well as commercial operations standpoint. I've now been investing for about 3 years now. So what I tend to look for is our innovative startups with a very clear differentiator as well, because this is very quickly becoming a very saturated space. They need to be solving a real world problem and have a large addressable market. I suppose what's important for me is to actually look at existing cap structures, and they need to be right at the stage of investment. And obviously, a strong founding team always helps.
Okay, hi guys. I presume I'm the founder of the first startup, so I presume they're ready for me to go ahead and pitch. Okay. So hi, my name is Dr. Jeff Munn. I'm the CEO and founder of Human People. I left NHS in 2007, set up a number of anti-aging clinics, and we do a lot of functional medicine in there as well. So I don't know if you recognize any of these problems: brain fog, anxiety, low mood, etc. And these are certainly the problems that we've seen in our clinics. And it's also the reason why 56% of people in the UK currently take supplements. But there's a bit of a problem with this. When you come to test these people, actually only 4% of them have optimal levels of nutrition. So they're not taking the right thing, they're not taking the right dose, and not the right combinations. It's all a bit broken. So we've come up with our solution, and that starts off with using a detailed AI questionnaire, and that's fantastic to define the problem, but it certainly doesn't give you the solution. And a number of companies have gone down this route. If you actually really want to make this work, you then need to do testing, and that starts off with a blood test for nutritional markers. We then add in DNA to profile and gut testing as well. And what's taken us a long time to really develop is an algorithm that integrates all of this health data together. And from that, we then will have over 80 supplements, and we choose your particular combination that works for you. Pack it in a daily pack, that gets sent off. It's a subscription business. It comes out, you get your subscription every month. You follow up all your results. There's other health advice that we give on the app. We re-engage with people. When they retest, that's when they really find that there's a higher level of compliance, better results, better retention. So one of the key things to making this work has been this fantastic blood device that recently CE marked we're about to place in the market. For home testing, it has to be easy. And with this device, you stick it on your arm, you press that button, you get a blood sample. You'll have pretty much 100% success rate with this, and this is a real game changer. So what have we done so far? We've run a 12-month pilot, we've validated our approach, we've now rebranded, rebuilt our platform. This is kind of sitting right in the middle of a number of different enormous areas, the supplement market, personalized medicine, and digital health. We've got a fantastic team across medicine, nutrition, tech. Paulette Carn Kidd, she's head of brand for Caffeine Nero, also ex-head at Nuffield Health. Fantastic record of taking and growing consumer-facing brands. In terms of numbers, if we look at year 3, just over 6,000 subscribers gets us to 11 million annual recurring revenue. We've already shown the business has a high margin, has a very low churn rate. So what we're looking for now is 800,000 to build out our tech stack, to get those customer touch points absolutely nailed down. A couple of key hires in there as well. To quickly get to 600 subscribers, that will give us a 1 million ARR, and we expect at least a 10x return for seed investors. So timing is perfect. Personal health's never been higher on the agenda. We've already built our platform, we're ready to launch. We have a small recurring revenue from the pilot still running. I've invested over 80,000 in the business. We already have 100,000 committed to the seed round. Personal health is right at the top of the global agenda. The reality is, a questionnaire plus a multivitamin just doesn't do anything. We know it doesn't work. So if you actually want to really help, this is the approach. So come and join us at Human People.
Thanks, Dr. Joff. I have a quick question, if that's okay. I'll jump in. Is that your proprietary hardware to draw the blood, or is that just a partnership with another?
Certainly not. So the company who's developed that's had almost 15 million in investment to develop that. So it was developed at MIT in the States.
Got it.
So we're the first people to bring over to UK to use it. So it will be a game changer, probably for a lot of companies, but it's a fantastic device.
Got it.
Jeff, can I jump in as well? I just had a question about your financials. Can you say more about your lifetime value of the customer? From my experience as a physician, vitamins have been something that a customer would take maybe 2 to 3 months a year, and then once they're feeling a bit better, then sort of leave it, and then maybe come back to it maybe 2 or 3 years later. So have you looked at the lifetime value and how that affects the revenue and the recurring revenue, as well as the customer acquisition cost to get that customer back? And how sticky is this product?
So what was the last question?
How sticky is the product, essentially?
So actually so we've worked out LTV and CAC scores, so healthy value, certainly over 12. With subscription with these supplements, what we find is that because you re-engage with people constantly and you're actually refining things, you don't get the same fatigue that you get. If someone has 4 bottles of supplements, they just don't take them. They get bored of taking these 4 supplements, and especially if they don't work. But if you engage with someone, if you test and you show that they're working and they can actually see those results, so they're kind of like, actually, I feel better, now I can see it's better, the stickiness is pretty high. So it's certainly not a 2 to 3 month issue. And actually, a lot of the other subscription companies, have found that as well. So, we do have a figure for lifetime value of just over £2,000. So, yes, it's a sticky product. Yes, people, when they can feel the improvements, do stay with it. And it's very much, if you want it to work, you've got to test. And it's, the challenge is how easy can you make that testing?
Jeff, if I can jump in, hi, and thank you for your presentation. 2 questions. First of all, this is a space that has a lot of traction lately. So how would your business compare to Nestle's Persona, which has created a lot of buzz from Nestle Health Sciences? And perhaps a more important question is, how much of an impact do you believe that your supplements will make to a client's overall health status?
So firstly, on the Persona question, and they do have a good tech team behind them. They've got a good functional medicine team behind them. If you look at their supplements, and this is probably the key difference, the doses of supplements they give are pretty low. And that's because they don't do any testing. They just do a questionnaire, and it's pretty generic what they then end up giving you. And given the team that's behind Persona, I kind of question why they do that, because we know that if you're in clinic, if you want to make a difference, you've got to find out what the problem is, and then you've got to fix it properly. So their approach is, it's almost a marketing gimmick, doing a questionnaire and just get it. And that's not the approach that we're willing to do. We kind of look, if you're going to do this, you do it properly. And sorry, Philip, your second question was?
So yes, my second question was basically because usually in most healthcare interventions, supplements are really the tip of the iceberg, right? There's a lot underneath it. So how much of a difference are you hoping to make? And you do DNA, you do gut health. So what is it that you're trying to achieve?
So there's a real mixture, and supplements aren't the answer to everything. They're one pillar that's in there, and there's a whole health journey in there. One thing that supplements can do, they're easy to take, and it's start of a journey. As people start to feel a little bit better, you tend to find that they improve other health behaviors. So when we look at DNA, it's not just about supplements. So for example, we've found a really high percentage of people in London are lactose intolerant, for example. And that little bit of knowledge has been life-changing for people. And so, pretty much, if you're not Northern kind of European, you've got about 90% chance of being lactose intolerant. And all of a sudden, these people kind of, realize that, fine, all of a sudden, I don't have issues with bloating and diet. I don't feel tired, etc. So yes, there's the supplement side, but there's also the health advice side as well. We're not trying to say that supplements can cure everything by any means. And a healthy diet, exercise, sleep, stress, it's all part of the ecosystem to do that. We're one part of it, and we feel that we can do that part particularly well.
Thank you.
Any other questions? Sorry.
Maybe just a quick one on the data. A lot of this is predicated on you being better at testing and recommending supplements. Where did you have your current data from, and how's it going for you?
So our data that we've been putting together, so obviously there's a lot of clinical research behind profiling people. So, we use the data to work out what the kind of biological profiling, so we can look at someone's inflammation profile, their detoxification profile, etc. We then integrate that with some of the blood results, so we know where the blood results should be, and we can then integrate that also with what a healthy microbiome is like, and that's been the really big challenge. The big challenge has been the data science part, how we put all this together to then spit out on the other side what used to take our nutritionists maybe 30 minutes to kind of go through all these details. We now got that down to to a couple of minutes where all of this comes out. And so we're still refining all of those weights on different areas. And so it's that kind of proof of concept as our algorithm now spits it out, what do our nutritionists, would they say the same thing? And we're pretty accurate on that. And in fact, what we do, we give the top 10 recommendations, and then we still review that. We have a dashboard with all the different profiles on there. So yeah, like it's ultimately, we're not doing the tests, we're not making the supplements. We're doing the tech in the middle that allows us to pull it all together.
I guess we're actually at the end of time, but I was very intrigued by your high revenue, low cost model. I would love to actually explore that in more detail with yourself offline.
Sure, happy to. Look, with supplements, one of the big benefits with our packaging method is that we have a robot in-house, and they're packaged into recyclable packs. So one of the big costs for supplements are the bottles. So you remove the bottles, you get less wastage, you get less supplement wastage. So actually, people are just buying supplements as opposed to all the other packaging with it. And you tend to find people get fatigued when you've got multi-bottle approach anyway. So there's less wastage all around. It allows you to turn it on and off whenever you actually want to use it. On the testing side, we've purposely kept the prices of the tests low, because that's kind of the barrier to entry in a way. But a blood test looking at 10 nutritional markers for £149 is pretty competitive. If you want to go into a clinic to do that, you're probably looking at £400 or £500.
Thank you.
Okay. Anything else, or not sure there's any moderators popping in.
I'm trying to communicate as much via the text as possible. So what happens now is, investors, we want you to give a thumbs up or a thumbs down as to whether you will have a follow-up meeting. And if you will, we'll do an email introduction after this. And if not, a very quick reason why would be fantastic. But we need to move on to the next one. So yeah, thumbs up or thumbs down to a follow-up meeting.
I guess it was just myself with the thumbs up. So
okay, yeah. Well, I look forward to catching up. Okay.
Thank you.
Thanks, guys.
Hi, everyone.
Hi.
Hello.
Yeah,
Hi.
we can hear you.
My name is Achna. I'm from New Tissue. I'm just getting the slides up. So with New Tissue, we are on a mission to eradicate chronic wounds with patient-specific scaffolds and bioelectric stimulation. We believe chronic wounds are a huge problem with no definitive solution at present. Amputation is a guaranteed solution, but patients receive treatments over a really long time to control the exudate or to slow down the advancement of the problem, but not to really heal the wounds. So, and once a wound progresses to the chronic stage, it becomes a burden for a lifetime. And we think it's a huge problem. And to consider how big this problem is, it's around 2.2 million people in the UK with chronic wounds. And that cost 5.3 billion to the UK in 2018. So I would really like the slides to be showing up. I'm not sure why it's not showing up.
Maybe we can get some help from the organizers.
Yes. So new tissue, we have effectively leveraged 3D printing, PRP, and bioelectric stimulation technologies previously to address wound repair. And with the new tissue, we want to combine the strengths of these technologies with our patentable product, which we have trademarked in the UK as Biomimics. This is a bioink that's electroconductive and it's 3D printable that can mimic the body's healing mechanism. So with this, we think we can completely and rapidly heal wounds without allowing the wounds to progress to a chronic state. We plan to charge a fee for a tailor-made package, patient-specific package that includes 3D scaffolds, electroconductive dressings, and electrotherapy. We also have off-the-shelf dressings and provide education on these applications so that it will be a marketing activity also. So these solutions allow us to enter these markets, and we will primarily focus on the wound care market, which is around 20 billion, and it's rising every year. We want to serve the primary care and inpatient groups, and we aim to capture 1% of the UK's market by 2025. That will bring us £40 million, but this is based on a lot of assumptions at the moment. And the nature of our solution also allows us to enter bioprinting and regenerative medicine markets also. We are looking to raise £250,000 to completely characterize the bioink and establish manufacturing and product handling protocols and clinical SOPs. We will partner with CPI, Center for Process Innovation, to achieve our manufacturing goals. So if you think it's an exciting and worthy mission, we'd be delighted to have you joining the journey. Thank you.
Thanks, Satula. I'd love to start off the questions by finding out a bit more about the whole bioelectric component to the wound repair. So why does it need to be an electroconductive 3D printed scaffold?
At the moment, we are applying electrotherapy to wounds, and that is, then we have to use normal dressings, and it's sort of a relative barrier because we have to keep opening and closing the wounds. And also, if you have a electroconductive dressing continuously, that's going to help with the procedure. That's why we think it's useful. And if you are making patient-specific scaffolds, it might as well make it electroconductive. There will be an option to make it without the electroconductive element, but that is our one of our main features.
What is the benefit of that? Is it that the wound heals faster? Does it create a more rigorous scaffold? Does it prevent infection? What's the actual scientific basis for it?
The scientific basis is that so the wounds progresses to the chronic state because it gets stuck in the inflammatory phase. So by applying the electrotherapy, we can push it forward so that it completes the healing, and also it's antibacterial, and that sort of helps with the healing. And with our experience, it sort of really reduces the time to heal, and that's why we want to apply this. And one of the reasons that it's not very well taken up, just electrotherapy, is this barrier that the dressings are not compatible with the application of electrotherapy. You would know, I'm sure.
And how does it compare to, so I've looked at the wound care market quite a bit. How does it compare to, let's say, oxygenation therapy or phototherapy or other, like what are how much better is it essentially in terms of the results you have so far?
So the results we have are just with the electrotherapy, not with the scaffold. And it's very, we can't sort of put them all together because this is what we need to do. We need to do larger studies, but small cohorts are showing relatively better outcome in terms of complete progressing the wound to complete healing, and also the time taken to heal as well.
Got it. Thank you.
How do you think about taking this to market? Like, who will be the first users, and who will help you position that or sell that in the long term?
So we think we can, we will want to be engaging with the primary care providers, which is one avenue, and another one to engage with the surgeons and the commissioning agents. Primary care will be a first approach, and even just for electrotherapy, we had to coordinate with GPs and care coordinators at the moment, and then sort of organize. So we think we have to sort of follow something like that, but in a more in a more structured way.
Ajala, thank you for your presentation. Perhaps I missed this part, but do you have a special interest in wound healing for some reason? Can you give us a little bit of background about yourself?
Yeah, well, I started. I was working on regenerative medicine as a research project, but then for some reason, I've come across people who have these problems, and just during the lockdown, actually, I organized. It so happened they had sort of missed care providers, and the lockdown had restricted access, and they knew that I was working on research, and sort of in talking, I then got electrotherapy provided to them, and sort of just very recently I've seen 2 cases with really rapid healing, and they had been suffering for ages. And even before that, I come from a Southeast Asian background, and we see a lot of diabetic wounds that don't heal very well, and this is a huge problem. Electrotherapy is really transformative in completely healing. So I like it to become much more widely applicable, because at the moment it's sort of it's not in the normal routine to offer electrotherapy. So this is why I think it's very impactful, and it needs to be out there. And there are restrictions because of the current structure, and we want to be able to make it easy to apply.
Thank you. Okay, so in an ideal case scenario, how much faster does the wound healing happen? So do you have an estimation of days that patient stay gets reduced? Because that could be an interesting angle with regard to the backlog in most healthcare systems, especially the NHS.
Absolutely. So, for example, if you apply electrotherapy every day for 1 hour, for 7 days, you can expect more than 50% reduction in the wound within 3 to 4 weeks. And the example I was telling you during the lockdown, this is a patient, elderly patient, so a lot of underlying conditions as well, had a non-healing wound for nearly 3 years, and it was exudating, etc. But with electrotherapy, it's now completely it's formed quite a scar formation because of the cellular. Now it's closed. So I didn't get to apply every day. We had to sort of get the carers to coordinate. But so 3 years compared to 3 months, not consistently applying as well. So it's really effective.
Okay.
I'm going to have to stop the questions because we've gone over time by a couple of minutes. But if you do have any other questions, we can put you in touch. Quick thumbs up, thumbs down for a follow-up meeting. Awesome. We can connect you.
So just to add from my perspective, I actually have no prior experience in this space, and I don't believe I can actually add any additional value beyond the capital investment. So it's purely on that basis, but I actually love what you're doing, and I think it's actually addressing a real issue. So please continue.
Thank you. And Dr.
Hi. Can everybody hear me?
Yes, we can hear you.
Okay. Okay, so hi, I'm Denai. I'm a doctor and the CEO of Yoxley. Yoxley helps people live healthy and happy, empowering them to date safely and with more confidence by making sexual health approachable, in vogue, and ubiquitous. In the age of modern dating, people aren't getting tested or treated. Some struggle to access sexual health services. Others don't even know they need to. To put this into context, someone in the UK is diagnosed with an STI every 70 seconds. STIs are on the rise, but gun clinics are closing across the nation, and remaining clinics are more than 500% oversubscribed. To combat this growing problem, Yoxley offers remote sexual health services, including educational yet relatable content, discrete at-home test kits, digital results records that can be stored or shared, and guidance on treatment and available support networks. We're creating an inclusive community designed to give users more convenience, privacy, accessibility, and control. Last year, the NHS performed 1.8 million STI tests. But if just half of single adults followed best medical practice, there should have been more than 13 million tests. North American and European markets are much larger. And with over 1 million STIs acquired every day around the world, the global STI diagnostics market is predicted to reach £100 billion by 2025. We're beginning as a B2C company, offering pay-as-you-go and subscription-based tests. It's just our first step in becoming the one-stop shop for all matters related to sexual health. Next, we'll expand into medications, form partnerships, and leverage our community of engaged users. We've built an MVP that meets all medical, legal, and GDPR requirements. Now we're trading. Our site launched at the end of last year. Since, we've had over 8,000 visits, of which 11% are returning visitors, and more than 400 people have joined Yoxley's community. So this is all very promising, but Yoxley is about something bigger. We've seen the normalization and destigmatization of mental health over the last few years. Yoxley will do the same for sexual health. So yes, we want to provide a practical service, but there is something bigger at stake. We want to involve everyone in a conversation once deemed taboo, but which is now on the cusp of a movement. To that end, our team numbers 3. But we aren't just co-founders. We are activists. I'm Denai. I'm a doctor with a background in public health. I've led other medtech startups. I've worked in healthcare for 18 years on 4 different continents, and I believe we can do better. There's Jason. He's a chemical physicist and Oxford University lecturer with hardware and software expertise. He's led tech teams across Europe and North America to develop the fastest camera in the world. There's Judson. He's a military historian and entrepreneur with operational and marketing experience. Through all of his graduate work, he studied Churchill. He was used to fighting for things big. And then there's our advisors. Together, we form a diverse and capable team that can execute our vision. Imagine a world where Yoxley changes the conversation so much that it becomes normal for prospective partners to demonstrate their commitment to sexual health. We are Yoxley, a movement that's breaking down barriers and making room for change, and we invite you to take part in that journey with us. Thank you. Is that okay?
Hi, Dana. Thank you for your presentation.
Thanks.
I'd just like to start by asking you about the whole, it's something that I came across with other companies in the sexual wellness space, is the way you market the product. And I know that social media websites like Facebook and Instagram ban this sort of marketing of a sexual wellness product. How do you see that in terms of your product positioning and your marketing?
Well, I think it depends. So we've actually been running ads on Facebook and Instagram, but they've been largely educational. So while there are certain things in the sexual wellness space that you can't put on those platforms, there are other things that you can. So really it's about raising brand awareness on those platforms and just trying to educate our users, because one of the problems we see is that people don't know how often they should be tested a lot of the time.
And what are the tests that you are offering through the platform?
So we have 4 test packages, each testing. So the first test for just chlamydia and gonorrhea, the second test for chlamydia, gonorrhea, and trichomoniasis, the third test for 6 STIs, and then the final test for 8 STIs. So, and obviously they're priced differently.
So are these swabs or urines or blood tests?
So there are vulvovaginal swabs and urine. And then for the last 2, which also tests for things like HIV, syphilis, hepatitis B, and hepatitis C, there is a pinprick blood sample.
Thank you.
Thanks.
And how do you compete with guys like Let's Get Checked and some established competitors? I suppose, is it around positioning or better product? Curious to hear your thoughts.
Yes, yeah, that's a great question. So our for-profit competitors, Let's Get Checked is a big one, but they're stock standard clinical diagnostics companies. So they offer a range of at-home tests, everything from cholesterol checks to STIs. But we have greater ambitions, so they go beyond just diagnostics because we want to spark an international sexual health movement. As part of that, we focus solely on sexual health because we want to be an authority in this space, everybody's go-to trusted source, and a leading lifestyle brand that's synonymous with sexual wellness. So that is positioning. But as a part of that, we also take a different approach. So it's fresh and friendly. We want it to be inclusive and contemporary and not overly clinical or alarmist. And Let's Get Checked's color palette is pretty mute because, again, we want to normalize and destigmatize the subject. The best way not to compete with what's already in the market is to offer something different. And that something is our ecosystem. So we incorporate a range of remote sexual health services in a way to give users a personalized experience, but that it also has plug and play potential. So by that, I mean they integrate with dating apps or Apple Health, for example. But the ecosystem is designed to give users more convenience, privacy, accessibility, and control. And I think that by improving access to sexual health services and also strategically partnering with key stakeholders, we can change the societal norms and expectations that surround sexual health.
Hey, Dana, thanks so much for your presentation. And I really liked your notion around making it comparable to mental health and making it also something very normal and casual to talk about. Can you expand a little bit more on the kind of the education and content part, if that's part of your business plan, and maybe also on the dating piece, because I thought there's something intriguing there if you can pull it off.
Yeah, so absolutely. So surrounding education. So we mentioned that a lot of people don't know how often they need to be tested. So currently, the medical practice, according to BASH is the British Association for Sexual Health and HIV, and of which I am a member. So the recommendation is that all sexually active adults receive an annual STI screen. And some people actually require testing every 3 to 6 months. But because people don't know how often they should be getting tested, or because there are barriers to accessing testing through traditional methods, they're not. So one of the things that we want to do is create more educational content. So we have a blog on our website. We're putting pieces out through our social channels, so Facebook, Instagram, Twitter as well. But we're trying to get a really diverse panel of people to talk about sexual health and wellness, because at the moment, a lot of it is very mainstream. And unfortunately, I think there are large segments of the population that feel as though they're left out. And so that's one of the ways that we hope to, I guess, further educate the audience, not just for themselves, but for also their potential partners. In terms, and I'm sorry, your second question was?
The dating angle and kind of, you said dating apps, integration there as a go-to-market. Is this something you already have live or are you thinking about?
So we haven't approached them yet because obviously you want to get your product user experience perfect before you approach and take on a whole bunch of new potential customers. But yes, so for example, Bumble allows you to put badges on your dating profile for if you drink, if you smoke, how you vote. What would it look like for Yaxley to have a Bumble badge so that users could put on their profile that they have an up-to-date sexual health screen? In that way, it's in line with a lot of the other initiatives that Bumble has put forth, but it also reshapes the dating conversation so that actually we're bringing those conversations about sexual health into real life situations. But yes, it is. It's sorry.
Oh, did I cut out somebody else?
No, that was me. Sorry.
Oh, okay. Thank you for your presentation, and it is indeed quite fresh, your approach and the way you guys are going about this. With regards to your direction, because definitely the dating element is very interesting, and with Bumble. So do you see yourself being involved more in that space or becoming more like hims and hers with a more kind of holistic approach with supplements, et cetera, et cetera?
So we've actually spoken to him. So our go-to-market strategy has a 3-pronged approach. Phase 1 is B2C. We're a consumer-centric company. We want to get that right. Phase 2 is B2B to C, where we speak to affiliates like dating apps. And we've actually spoken to the head of HIMSS in the UK. And then our Phase 3 would be going B2B. But we absolutely want to build out our service. So we don't want to be a company that just tells you that you've got chlamydia and then we kind of close the door. We want to be able to provide people with a more complete experience. So education is the first part of that, followed by testing, followed by the digital results records, which do incorporate with things like dating apps. We're looking at partnering with an online pharmacy to offer treatments. So not just treatments for STIs, but other medications in the healthcare space. You could do birth control, PrEP, for example, is another one. And then after that, we're also not concerned, but we're focused on the psychological well-being of patients as well, because it's not just their sexual health doesn't exist in a vacuum. It also exists, it's a part of their mental, emotional, and well-being. So we'd like to put widgets in the screen to be able to track and see what people are most worried about. What questions are they asking? What are their biggest fears? So we can create content to address those. But we'd also like to have automated touch points and integrate with mental health apps to see how people are coping. As we develop the whole system, we'd like to create patient-provider networks. So for example, there could be healthcare professionals who create content for Yoxley. And then if our users, if they see that content and it resonates with them and they like this particular provider, we could create a system whereby patients and providers could find one another through our platform. So long-term, it's a holistic approach. I think medicine is trending in that direction anyway. And I think there's something to be said for remote services. Oh, sorry, Purdy. Okay.
No, sorry. We're a few minutes over, so you can finish off what you're saying though, and then we'll do the thumbs up, thumbs down thing.
But yeah, I believe you can't look at people just in the absence of disease. You have to look at them as a whole person. And so we want to create this seamless, integrated experience where they can get all of their sexual health needs met in one place.
Sorry, I just have one question. Have you actually done any market research about people willing to actually bypass the self-referral clinical pathway within the NHS and actually pay for the test themselves?
Yes, so we're trading. So we're selling test kits. We've done market research before launching, and I work in the emergency department, so I can tell you all about my experience with patients who tend to go private.
Thank you.
And maybe I missed this, but what are you raising?
So we're raising £250,000 as a pre-seed round. So we have 3 angel investors committed currently, and we're hoping to close by the end of the month.
Got it, thank you.
So what are we thinking, investors, in terms of a follow-up meeting? Thumbs up, thumbs down? We will connect you via email afterwards if you want to continue the conversation.
It's mostly due to round size and the early nature of the business, but we'd love to keep in touch for seed, Series A, and beyond.
That's great. Well, thank you, guys. It was lovely to meet you all. Look forward to talking.
Thank you.
Hi, everyone. Can you hear me? Great. Okay, first of all, I've got to apologise if you hear any screaming in the background. It's probably hopefully my 1-year-old twins causing havoc. So one of the problems we have to deal with these days working from home. Thank you very much. Okay, cool. Can you see my screen?
Not yet.
Not yet?
Yeah.
So just, can you see it now?
Yep.
Yep, all good? Right, okay. Thank you very much for your time today. My name is Rav Roberts. I'm the CEO of Pharma Sentinel, a very disruptive and innovative health tech with global ambitions. Importantly, I'm diabetic and have been for 17 years, which is part of the inspiration for what we're doing in this company. Hello, I hope you can see everything still, right? Okay, so what is the problem? Well, we've got a decades-old user journey that hasn't changed. And the problem is that people get help after experiencing a health issue. So often something goes wrong and they go to social media or they go to Google and look for a solution. And this has catastrophic repercussions. 100,000 UK emergency hospital admissions a year are caused by side effects of prescribed drugs. And we're talking about a large percentage of the population. 29 million people in the UK alone are on one repeat prescription for a chronic condition, including 60% of women in their 50s. So this brings us to our consumer solution. We use artificial intelligence to deliver you push news, information, and alerts on from trusted sources on medicines and medical conditions news that you or your loved ones need to follow. We're talking about mental health, women's health, and news such as drug safety alerts, new drugs, clinical trial opportunities, and even comorbidities. Importantly, we're also looking to start our B2B service, a white label service. And this is to help increase lifetime engagement with customers for health insurers, retailers with in-store pharmacies, and we're in discussions with a couple already. But it can be extended to primary, secondary, and tertiary care. In terms of our competitors, there's no one quite like us. We've looked at many more competitors than this. Just one feature, we link our users to patient support groups for further help and support. And we think that's very valuable. We launched 4 months ago, and we already have 15,000 app downloads in over 100 countries and some great user feedback as well. So you can see Alfred, a trainee pharmacist in Ghana, and his team are using our app to stay updated with the latest medicines and medical conditions news. And our app is very engaging, constantly updating, Twitter-style interface where you can like, save, share, and follow different medicines and medical conditions as well. In terms of our revenues, B2C will have in-stream ads and subscriptions for high-value content, and B2B, our white label service, as I said, and data as a service for other industry verticals as well. We've just closed our pre-seed round, and we raised £217,000 from 22 investors in the US, Germany, Italy, and the UK. And now we've started our seed round, and we've already had 200K committed to that. The founders have known each other for 16 years when we met on our executive MBAs. We've got great large industry experience and startup experience as well. I had a startup in San Francisco and previously had a different startup with Paolo, our CTO, who we sold. And we've got great cross-functional experience necessary to take this to the next level. And here are our advisors, just pointing out one, Dr. Bob Adams. He's helping us break into the US market, and we start that journey next month. We've just signed an agreement where to get US medicines data, 20,000 medicines into our database, and then we'll be able to start using our app and our white label service to break into America. So thank you very much, and I'll be happy to answer any questions you have.
Hi, thank you so much for the presentation. I'd just like to start off the questions, just understanding a bit more about what medicine alerts you actually provide, what sort of health information you're providing, and who is your customer? Is it health systems or provider networks? You could say that as well.
Yeah, absolutely. So we're providing drug safety information, new drug opportunities, clinical trial updates, clinical trial opportunities for people to participate in, and comorbidity information as well. So if you suffer from diabetes, as I do, you almost certainly either suffer from high cholesterol or you're going to suffer from it later in life. So our artificial intelligence actually takes the information and feeds it to you. If you think about it, it's a bit like Netflix recommender or Amazon's recommender, but for health and medicines conditions. In terms of our customers, from the consumer side, it's pretty much, it's around half the population, not just in the UK, that take medicines for a chronic condition, or they're looking after someone that does, they're caring for someone that does. In terms of B2B, we've got different industry verticals. So retailers with in-store pharmacies, we're talking to one in the US already, a big one, and health insurers, primary care, secondary care, who want the latest information. So, for example, Alfred, the pharmacist in Ghana, is using our app to keep up to date on the latest information on medicines, conditions, that sort of thing.
Thank you.
Thanks.
Thank you for your presentation. In your competitor analysis, where you had Google, etc., I didn't see MedPage or Medscape. Are they not a competitor at all? Or because I use one of them, and I kind of have the feel that they provide a fairly similar service without the perhaps the clinical trials updates.
Yeah, so we have looked at one Medscape, not the other one, and we've looked at several other competitors, big ones and small ones. The difference is the user experience, really. You have to spend time going to these applications or websites, and you can't really tailor the information you want. So with a click of a button in our app, just like Twitter, you follow a different topic, medical condition or drug, and then you get your alerts pushed to you. So we have a different user experience that from feedback from our users is quite valuable. The feedback says anyway. Does that answer your question? Sorry.
I think so. So the proprietary element is that you're able to allow notifications for these specific segments that interest you.
Yeah, and we constantly update our app. It's pretty much exactly like Twitter, but with added features. We're going to, for our B2B clients, add consultation element and offers. For example, a company like Walmart will be able to send personalized offers to their customers in our app.
Okay, thank you.
Thanks.
And what's the engagement? So you said 15,000 downloads, and then what kind of usage patterns do you see? Are we talking daily, or they just keep it on their phones? Yeah, what data do you have?
Yes, so we've launched our App Store and Play Store Android and iOS apps 4 months ago, and we're just about to launch our web app to increase people accessibility. We've got about 500 daily active users at the moment, and they spend 2 minutes 21 seconds on the app on average, looking at different information. We're still very much building our app, though. So we've just signed got an agreement with the NHS to syndicate their information and videos in our app. So we're looking to build that out with live streaming, interviews, and more functionality as well.
Hey, Raf, thanks so much for your presentation. Maybe one question. Well, what's the big vision here? Where do you want to be in, let's say, 10 years? What do you stand for with Pharma Sentinel?
So we're looking to help people that have chronic health conditions manage their health and safety better. That's our long-term vision. And we are looking to go global, really. Our big market opportunity is in the USA, and we want to launch our consumer app and the white label and data as a service apps in the US in the next year, which the funding that we're looking for will help us achieve. In 10 years from now, we want to be serving people all over the world and companies in different industry verticals all over the world as well, from health insurance to retailers, and even a white label service for employers. On average, the stats show that 50% of employees have a chronic health condition, and almost certainly they're going to social media and getting misinformation for that to help treat that condition, which results in catastrophic outcomes.
And you mentioned the UK and the US, but some of your first users come out of Africa. What about other markets? Could they be a good growth path?
Yes, we are looking at the developing world, but initially the UK, the US, and we've actually got a team. Our artificial intelligence team is in Italy, and they're interested in franchising our app for use in Italy as well. I think they're actually watching this at the moment. So we've got to have the funding to be able to scale. But in terms of ambitions, we definitely want to scale globally. We see the developing world in particular as benefiting from this. And actually, even when we have a subscription service, we've committed that all our information on developing world conditions such as malaria, tuberculosis, AIDS, and Ebola is going to be free for all users everywhere. And we know that they are already using phones to connect and communicate. So we think that will become pervasive over the next decade.
I'm going to have to stop the questions because we're just a bit over time. So any feedback for Farmer Sentinel? Thumbs up, thumbs down for follow-up meetings?
I love the vision, but I'm still feeling missing a little bit the pieces how you get to that vision, and also for us as deep tech investors, like what's kind of the technology, the data secret sauce that's driving that. So I'm afraid I have to say no.
Okay.
Just to share my perspective as well, I've actually had a chance to actually download the app and play with it while we were discussing this, and the user experience, I would say, actually looks fantastic. But I've actually had involvement previously in this space, and it was very challenging for us to actually monetize this, even though we actually had a high number of downloads and lots of users using it. So just purely for that reason of past, I'd be opting out. Thank you.
Yeah, I'm similar, Rob. In terms of go-to-market monetization, I love the vision of providing accurate information to as many people as possible, especially on complex drugs. But the go-to-market is still a bit unclear, and I think will be challenging. But yeah, very good luck to you.
Thank you. Thanks.
For me, it's the defensibility and the barriers for another company to come and take the same space. It doesn't seem to be there at the moment. So that's why for me it's a path.
And yeah, to echo Ahmad and Matt, it's pretty much the same for me. So I'm struggling a little bit to see the clarity in monetizing this, because it's usually a big challenge in this type of software service. But yeah, definitely best.
Thank you.
Hello. Nice to meet you guys. I'm Candace Hampson, CEO of Liminal Health. I'm just going to share my screen. Is that working okay? Let's see. Yep, yeah. Great. Thank you. Okay, great. So yes, I'm Candace Hampson, CEO of Liminal Health. We're based in Buckinghamshire. 5 years ago, I was diagnosed with early stage breast cancer. After years of treatment, thankfully, I have been cancer-free for the past 3 years. But it was not an easy journey. I couldn't find credible information or support to help me change the habits I needed to. I was never told that getting enough physical activity, for example, could reduce my risk of recurrence by 30 to 40%. Cancer is one of many long-term illnesses affecting the UK today. 1 in 3 workers face at least one chronic condition, while 1 in 5 face 2 or more. Resulting churn can be expensive, up to 30K per lever, and attempts to address this have not been working. Many long-term conditions are preventable through lifestyle changes. However, people are not sufficiently supported to improve their diet, exercise, sleep, and stress levels. Equally, not many are aware of how much they need to be doing on their own. It may seem simple, but these are really difficult changes to make yourself. So Liminal Health works with employers to provide personalized content and health coaching, activating lifestyle and behavior change in employees affected by chronic conditions, such as cancer, IBS, diabetes, and long COVID. We currently deliver one-on-one human coaching. Over time, we will deliver personalized content relevant to each user, with the aim of replacing a portion of in-person coaching sessions. We will create self-navigable content modules, and will provide disease-specific information to people, supporting their journeys to recovery and wellness. The potential market is huge. Millions of people of working age are affected by these conditions, and 45% of businesses already offer workplace wellness programs, so we have lots of room to grow. There are many startups offering workplace mental health services. We are better because we offer a holistic take on health that addresses not only mental health, but also nutrition, physical activity, mind-body connection. We also offer a breadth in conditions that we will support and a more personalized service than traditional wellness benefits like yoga classes and fruit baskets. We've shown great traction to date. We have 3 paying clients, have delivered over 50 coaching sessions, and are proud to be working with 2 health sector support programs, and have earned a $20,000 research grant from Sheffield Hallam University. We also have a fantastic team. I bring deep patient experience and business development from over 10 years of innovation consulting and impact investing. Christine, my co-founder and CMO, has over 20 years experience in content marketing for global brands. Our head of product and tech, Urian, comes with over 10 years in developing health tech products. And our advisors span the charity, clinical psychology, and tech sectors. We are currently raising a $250,000 angel round to close at the end of this month. We've already secured the majority from a pre-seed fund and a few individuals, leaving less than $50,000 in EIS eligible investments in this round. Please do get in touch if you'd like to hear more. Thank you very much.
Thanks so much, Candice. Thank you for your presentation. I'd just like to start, thank you for sharing your personal story and your journey and how this has inspired you to start this company. So that's really nice to hear. I just wanted to understand a bit more about your vision for this company in terms of where you see it going, how many users you're expecting over what sort of timeline, if you see this going beyond like cancer or other conditions, and then also the revenues and your potential exit strategy.
Sure. Yeah, lots of questions. So our vision is really a world where everyone finds it easy to be proactive about their health. So this has really come from my personal experience. If someone had come to me the year before I was diagnosed and said, you have to eat better and do more exercise, I would have told them to go fly a kite. Like, this has nothing to do with me. So how do we use content, gamification, rewards, and partnerships to really incentivize people to look after themselves from a lifestyle perspective? And really what we're talking about is the factors that you can control at home when you're away from the medical environment. So how do we help people kind of stick to good habits outside of the home? Our ambition is definitely global and to reach millions of people. So we are a social enterprise business. We talk about ourselves as a social enterprise and hoping to become a B Corp in future. Our purpose for existence is really to reach and impact millions of lives and help people change their habits and eventually prevent disease. But that's quite a big claim. So that's kind of in terms of the vision and stuff. I guess in terms of our growth, so where we are positioned, where we're starting is B2B. We did explore some kind of NHS routes at the beginning, but we decided that it would take quite a long time for us to get there. And we wanted to partner and start learning as quickly as possible. So that's why we're partnering with companies first, getting early revenues in now. We've already generated revenue through our kind of coaching services and hoping to generate that evidence of what we're doing is working and using that to kind of sell into the NHS and public sector in maybe 2 to 3 years. We also see this being a B2C company along those kind of timeframes as well. Once we've built up our brand enough and there's enough kind of recognition of what we're doing and that it works, that people kind of come to us themselves. But that's again, kind of a longer term view.
And do you see yourself, hey Candice, by the way, good to see you. Yeah, do you see yourself delivering the service through employers through, let's say, a third party? I don't know, through a Vitality or through a benefits platform, or do you see yourself as standalone?
Yeah, really good question. I think we are open to exploring everything at the moment. We've started by selling directly into companies where we've either had a warm introduction in. One of our 3 pilot companies has actually been a cold outreach on LinkedIn. They just really saw the value of what we were doing. So direct sales is a route that is working. But in order to reach greater scale, we have been exploring partnerships with insurance, like employee benefits insurance aggregators and benefits consultants as well. So that's kind of in the pipeline.
Hi, Candice. Thank you for your presentation. Just to, first of all, congrats on raising most of your first round already and for having Antler to back you. My confusion is that you say that this service is mostly around preventative medicine, right? And with the preventative healthcare overall, and also with your personal experience. However, you say that you mostly target clients that already have existing conditions. So I'm just trying to see, do you guys step in once there is a diagnosis and then you try to prevent or help with reoccurrence, or you want to go early on and be more of a preventative healthcare game?
Yeah, so I think both. I think where we're starting with is where the need is most acute. So really starting with helping people who need that the most, where they have already a chronic condition and we can help them better manage that, feel better in themselves, take less sick days, be less absent, be more productive at work, more engaged and more loyal. But we definitely have big ambitions to be kind of playing in that preventative health realm over the longer term, potentially by doing those kinds of things that I mentioned before, partnering with brands, providing rewards and loyalty, opportunities for people, gamifying some of our content on our platform, et cetera. So a bit of both, but it's a question of in what order.
Thank you. Okay, I have a follow-up question if no one does.
Sure.
To what Matt was saying earlier, because I think when it comes to going on a B2C model, it's really interesting to see how much of the pot under employee well-being will the insurance cover on this. So is it something that you've already explored with the offering that you have, or do your existing clients pay out of their own pocket? How does it work?
So existing clients, we did try going B2C first. We ran a couple of tests on Instagram, Facebook. In the UK, we found it really difficult. So we had a really high click-through rate to our website and not a single conversion to a free coaching session. I think we had Hotjar running at the time, and we could see that people hovered around what is health coaching. So in the UK, we have 2 big barriers. People don't really know what health coaching is and what the benefits are that, as individuals could do for them. And 2, they're really not used to paying for their own health interventions. So that's why we pivoted to a B2B model, because A, they're used to coaching. They use exec coaching all the time. So it's not that big of a leap to think about health coaching and how that can impact the long-term health of your employees, particularly after this past year of really bad wellness in companies. And also they are willing to pay and invest in their employees' health over the long term. So so that's kind of where we've come from. But we do believe returning to B2C in the future could be a really interesting possibility.
Thank you.
All right, fantastic. Thank you so much. Now is the moment of truth. Thumbs up or thumbs down?
For me, it will be a thumbs down, mostly because I have an experience with a startup I've invested in the past, and I think your journey going to the B2B model and trying to incorporate insurances and trying to understand how many people within the company will be using it and how is that utilized, it's very complex. I would definitely want to hear more about you later on. But for me, that kind of pathway is not very clear yet, because you haven't really experienced it enough. But
yeah.
Thank you so much.
Yeah, thank you. I mean, I'd love to hear more about that later and learn from your experience if possible. Thanks.
And I believe we've actually spoken before, you may recall. So it's, I think for me, it's actually a bit of a lack of a niche focus, but your model approach is very different. I think you're brilliant. And I did say that if you ever decide to actually work specifically within the breast cancer space, then I would be very interested.
Great, thank you.
For me, I love your passion and what you're doing and how you're going to change other people's lives who've been in the same situation. But I don't have any strategic value to add as an investor in your company.
Okay, great. Thank you guys so much.
Hi, everyone. Very glad to be here. It's always nerve-wracking to be the last after seeing many good pitches, but I'll try my best. Share my screen. All right. Can you see my screen?
Yep.
Cool. Thank you. So hi, I'm Keith, CEO and co-founder of MedWise, and our mission is to support clinicians so they can provide the best care to patients. When I was a medical doctor, I used to work 36-hour shifts. It's very tiring, and in the middle of the night at 2 a.m., I would have to make clinical decisions within a few minutes. And out of desperation, sometimes I would just Google for information, but I am often frustrated by the amount of irrelevant information and noise and fail to arrive at the answer that I need. So why are doctors Googling? With 6 million biomedical journal articles published every year, it is impossible to keep up to date with all the knowledge that is coming out. Currently, up to half of the clinical questions asked by doctors are abandoned and unanswered, and this has been published in a peer-reviewed journal article on JAMA, systematic review. And this means that despite best intentions, sometimes clinicians may not be providing the best care to patients. Lack of adoption of best practice care actually costs the NHS around £5 billion per year and the US around 105 billion every year. There must be a better way of taking all the training that doctors have learned and all the latest knowledge discovered and making it accessible immediately at the point of care. So at MedWise, we're building that solution. We make it super easy for clinicians to find the information they need. As a clinician, you can go to our website on mobile or desktop, type in your clinical question, press enter, and then our AI will do the work for you. And you will see bite-sized answers extracted from open access journal articles, NICE guidelines, and other professionally curated knowledge resources. The best thing about our platform is that the AI will continuously learn from the data and improve. We have launched a COVID-19 proof of concept, and on the back of this, won an Innovate UK grant out of 8,600 applicants to further develop our platform, and we have received positive feedback from clinicians. And we also already have interest from 4 different healthcare verticals, GP practices, hospitals, to run pilots with us, and also have interest from pharma and telemedicine companies to license our technology. We'll be selling our solution using a B2B SaaS approach and tailoring our platform technology to specific needs and use cases of our partners. The global market of the clinical decision support tool is around £10 billion per year, growing at around 10% per year. So we're starting in the UK, but have ambition to grow to international markets such as US, Canada, Australia. So looking at our competitors, we combine the best of both worlds. So we have high quality professional content that is similar to kind of from up-to-date Medscape, etc. But those solutions are very text-heavy. They're like Wikipedia on steroids for doctors, and at the point of care, sometimes could be difficult to use. On the other hand, Google have the best search and AI out there, but they're really patient-facing rather than clinician-facing. So we combine the best of both worlds and really understand the information need and the needs of our partners first, and provide a question answering interface for our users. On top of being a medical doctor, I also have experience helping improve productivity in NHS hospitals, and I've also got experience selling up to 1.5 million worth of digital health solutions to life science companies. My co-founder, Dan, has a PhD in natural language processing and was previously at Google and Amazon Alexa. We have a very strong board of advisors across clinical, technical, and commercial domains as well, and are supported by numerous accelerator programs. Currently, we're raising 534K to bring a robust commercial product to deployment in the NHS and with life science partners. We have already closed 350K from lead investor at SFC Capital and also from Wayride and Novartis, when we're closing the remaining 182K. We aim to exit in 8 to 10 years at a 10x revenue multiple. We would love you to join us on our journey to create a world where people receive the best care science has to offer. Thank you.
Thank you so much, Keith. I would love to start off the questions with just finding out a bit more about what sort of clinical decisions, sort of questions the clinicians can ask from the platform. Just with the context of, we've seen how IBM Watson is now up for sale. You know, they put out this great big idea that they were going to search the literature and then provide it to clinicians in a convenient, accessible way. And you know, a few years later, we're still here and they're selling. And so I just want to understand, you know, where you're searching the data and how you plan to answer clinician questions.
Yeah, that's a great question. So the approach that IBM Watson take is different to ours. So their approach was like buying up a lot of companies, having the data, and then run AI on top of it. So they didn't really understand the problem, and they were not starting from the need. They were starting from the data and the tech. So for us, it's very important for us to understand the problem and challenges that our partners are facing. So for example, one discussion that I'll be having later this afternoon is with a academic health science network, and to support them in the program that can improve adoption of best practice lipid management care. How can we improve the rapid uptake of some new products like PCSK9 inhibitors that could help, and also the holistic care pathway. How can we transform those local guidelines and different content sources into a very easy to use point of care decision support tool. So we start from the need and information need from clinicians, and also the challenges that our partners face first. And right, I guess just to add a bit on that, the technology have also moved on. So we're using the latest technologies like transformer-based neural networks, while IBM Watson's technology is probably, they started 10 years ago.
I'm sure the others have put questions. I hope you don't mind if I just ask a follow-on question. It's just about how you, when you say enter the NHS, the whole procedure for becoming a clinical decision tool encompasses a whole new set of hurdles and challenges to overcome in terms of the DTAC criteria and other other criteria to become a decision maker in the NHS. Have you sort of started with that framework, and how are things going?
Yeah, so we are familiar with the DTAC framework, with the NICE framework. However, our positioning is that we are a medical information tool, such as, for example, UpToDate would say that they are a clinical decision support tool as well, but I'm sure they don't need to go through DTAC. And for example, Google does not have to go through DTAC as well. So the idea is that we are providing medical information, but we're not doing any calculation on top of patient data, etc. So in terms of, we've looked at FDA, MHRA, and European Commission guidelines. In terms of clinical decision support tools, there are two types. One is considered as a medical device, the other is not. And we are currently the type that is not considered as a medical device. So this is kind of a very lengthy topic, and I'm happy to catch up in another call.
Is there a lot of customization needed if you sell to a Novartis, like, I don't know, medical affairs versus a public body or NHS organization?
Sorry, you jittered a bit there.
Oh, okay. I'm just saying if there's a lot of customization, like like FTE hours to customize the product to like a Novartis versus I don't know, a clinic.
Yes. So we are currently building tools to automate as much as possible, but there will be a level of customization needed for each deployment, depending on the needs of our partners. And we think that by providing those customization and really addressing the problems, we can get better user penetration and user adoption, because we are we then differentiate ourselves from the very generic solutions like Google and UpToDate. Down the line, with more and more use cases and deployments, then we will have built more and more tools to automate that customization process, and things will get more efficient as we scale.
Hey Keith, thanks so much for the presentation. Really interesting. How do you think about data privacy and using the insights you glean from users, right? I mean, it's all quite sensitive, and if you want to improve the tool and take back the learnings, how do you want to handle it? How do you want to manage that?
Yes, so I think in terms of data privacy, we are not taking any patient data on the platform. So it is more around a search, for example, what is the best treatment pathway or the treatment option. And we're not taking patient data as of now. There is a potential for us when we have identified specific use cases where we see a lot of need to potentially expand our product line into taking in patient data and move into the medical device grade clinical decision support tools. But that will probably be post Series A that we think about it. So in terms of just the clinician data that we're collecting, we will follow all the necessary requirement for standard GDPR requirements.
Mm-hmm. And what will be the way how users can engage? Is it like fiddling a little bit on small devices? Is it a web app? Is there a voice interface that you've thought about or considered?
Yes. So right now it is just a web interface. So it's a web app that you can access it both on desktop and mobile. And we have thought about voice interface, but sometimes in a clinical environment, it can be quite noisy. So you may not get the best information out of there. And just having a text-based search can be quite simple as well. My co-founder actually worked at Amazon Alexa, and he was at the Alexa Prize as well, so he can tell you a lot more about chatbots. Anyway, I missed the other question.
No, that's it. What did you consider in terms of input and what works and where you might want to take it? But that's helpful. Thank you.
Great. Okay, we are just at the end, so can we get our final thumbs up or thumbs down?
Yeah. Sorry, Keith, I just had a quick question. You actually mentioned that this could be used at the point of care. Is that within primary care or within the secondary care environment?
Yeah, it can be both. We actually have interest from both. And for example, in secondary care, we are scoping a pilot study with Bessie Cadwallader University Health Board, which is a hospital in Wales in the specialty of acute medicine. And we're co-applying to some Innovate UK grants to get the funding for those pilot studies.
Okay, thank you.
Okay, thumbs up or thumbs down? Almost perfect. Bravo, Keith. Very nice. You did an excellent job in wrapping up the event. So big thank you to our investors, our fantastic pitchers, and thank you to everyone for tuning in. If you'd like to connect with any of the startups, shoot us an email at hello@spystartups.com, and we're happy to help with that. Also, stay tuned for the discount code for Seed Legals, which will be going out on the Eventbrite. So thank you. Round of applause.
Thank you.
Thanks, everyone. Have a good day.
Thanks so much for all the founders for presenting. Thank you.
Thank you, guys.
Bye. Bye.